You're at home, suddenly intense chest pain, can't breathe, arm goes numb, classic heart attack symptoms. You need to get to a hospital, now. Do you call 911? No. You pull out your phone and you call an Uber. Not because you're stupid, not because you don't value your life, but because you know that ambulance ride will cost you $3,000. And the Uber? $15. So you gamble with your life because living in America means choosing between medical bankruptcy and maybe dying in a stranger's Toyota Camry. Welcome to America, the only developed country on Earth where people are genuinely afraid to call for emergency medical help because the bill might bankrupt them. Today I'm going to explain how we got here, how ambulance companies became predatory businesses, charging luxury prices for life or death services, how insurance companies found new ways to screw you even when you're literally dying, and how Americans have normalized bleeding out in the back of Ubers because that's cheaper than calling 911. This is the social glitch. Let's talk about the $3,000 ride and why Americans fear ambulances more than death. And before you comment, just move to another country. Remember, most of us can't. We're trapped in a system designed to extract every dollar from us until we die. Probably in an Uber.
Let me tell you about Sarah from Chicago. 2019, she's at work. She starts feeling dizzy. Vision gets blurry. She collapses. Her coworkers panic. Someone reaches for their phone to call 911. Sarah, barely conscious, whispers, "No, ambulance, call Uber." They think she's delirious. She's not. She's doing math. She has $800 in her checking account. Rent is due in 3 days. An ambulance ride in Chicago costs $1,500 minimum, plus the ER bill, plus whatever tests they run. She knows one ambulance ride will financially destroy her. So she gambles. Uber to the ER, $12. She's lucky. She makes it. Turns out she had a severe allergic reaction. Doctors said if she'd waited 20 more minutes, she might have died. But she didn't die, and she didn't go bankrupt. This is America.
Uber drivers have been posting stories for years. A driver from Los Angeles picked up a guy bleeding from his head. He kept apologizing for getting blood on my seat, said he couldn't afford an ambulance. I drove 90 miles per hour to the hospital. He tipped me $5. Driver from New York. Woman in labor got in my car. She was timing contractions on her phone. I asked why she didn't call an ambulance. She laughed and said, "Do you know what that costs?" Driver from Miami. Guy having a seizure. His friend held him down in my back seat. They paid the $8 fare and ran into the ER. My car smelled like vomit for a week. There are memes about this. Call an Uber, not an ambulance. Uber pool to the ER. RIP my Uber rating, but at least I'm not in medical debt. This isn't funny. This is dystopian. We've normalized using a ride-sharing app designed for getting to brunch as emergency medical transport because the actual emergency medical transport costs more than rent.
A 2019 study from the University of Kansas found that in areas with Uber and Lyft, ambulance usage dropped significantly, not because people got healthier, because people started using Ubers as ambulances. Another study, 7% of Uber rides to hospitals are for emergency medical situations. 7% doesn't sound like much until you realize that's millions of people per year choosing an unlicensed driver over trained paramedics because of cost. People are wearing medical alert bracelets that say, "Do not call an ambulance unless I am dying." Let me repeat that. People are begging strangers not to save them unless they're literally on the verge of death because they can't afford the bill. There are documented cases of people with "do not call ambulance" tattoos. One man in Colorado has a tattoo on his chest, "No ambulance, Uber only." He's not joking. He's not making a statement. He's trying to avoid bankruptcy. Think about that. We live in a country where people are so terrified of medical bills that they'd rather die than call for help.
Let's look at real ambulance bills. Los Angeles, 2023. Base charge, $1,800. Mileage, 4 miles, $600. Medical supplies, $400. Assessment, $300. Total, $3,100. New York City, 2022. Base charge, $900. Advanced life support, $1,400. Mileage, 2 miles, $400. Oxygen, $150. Total, $2,850. Rural Texas, 2023. Base charge, $2,500. Mileage, 15 miles, $1,200. Emergency fee, $800. Total, $4,500. They charge per mile, like you're riding in a luxury limousine, not a life-saving vehicle. Some companies charge $50 to $100 per mile. You know what else charges per mile? Private jets. Here's where it gets really dark. In the 1970s and 80s, most ambulance services were run by fire departments or local governments, non-profit, public service. Then private equity discovered they could make money off dying people. Now over 60% of ambulance services are privately owned. Companies like American Medical Response, AMR, owned by private equity. Rural Metro, owned by private equity. Falk, owned by private equity. These aren't healthcare companies, they're investment firms extracting profit from emergencies. Here's how private equity ambulance companies maximize profit. 1. Charge maximum rates. Bill everything separately. Add fees for every supply. Charge premium for life support, even if not needed. 2. Stay out of insurance networks. Refuse to negotiate with insurance companies. Charge patients full out-of-network rates. Patients have no choice during emergencies. 3. Reduce costs by cutting staff. Fewer ambulances, lower paid EMTs, longer response times, but same price. Result? Higher profits, worse service, patients financially destroyed. Here's the scam that ruins lives. You have health insurance, good insurance. You pay $600 a month for premiums. You have a heart attack. Your wife calls 911. Ambulance takes you to an in-network hospital. You survive. You think, thank God I have insurance. 3 months later, you get a bill, $2,800. Why? The ambulance company was out of network. Your insurance covers $200. You owe the rest. You had no choice. You were unconscious. Your wife called 911. The dispatcher sent the nearest ambulance. That ambulance happened to be owned by a private company that's out of your network. Let me tell you how it works in the UK. You have a heart attack. You call 999. An ambulance arrives. Paramedics treat you. They transport you to the hospital. You receive emergency care. Cost? £0. Zero. Nothing. Nada. No bill, no insurance hassle, no surprise charges. The ambulance service is funded by taxes. It's a public service, like fire departments, like police, because saving lives shouldn't be a business. In most Canadian provinces, ambulance ride costs $45 to $240 depending on the province. In some provinces, if it's a genuine emergency, it's free. In Ontario, $45 if medically necessary, $240 if not necessary. That's it. No surprise bills, no out-of-network scams, no $3,000 charges. 80 Canadian dollars, 60 USD. That's less than a nice dinner. In Germany, ambulance transport is covered by mandatory health insurance. You might pay a small copay, 10 euros, 11 US dollars. That's it. No $3,000 bills, no out-of-network traps, no surprise billing, because German insurance is actual insurance. It covers what it says it covers. Australia is interesting. Ambulance can cost $1,000 plus if you're not covered. But most Australians have ambulance coverage included in their state-based or private health insurance for about $50 a year. $50 per year for unlimited ambulance coverage. In America, one ambulance ride costs $3,000. In Japan, ambulance services are provided by local fire departments. Free. You might pay a small fee at the hospital, 3,000 to 5,000 yen, or about $20 to $30.
and Japanese people think this is too expensive. They apologize for using ambulances unnecessarily. Meanwhile, Americans are Ubering to the ER and apologizing for bleeding in the car. Let's be clear. Every developed country provides affordable or free emergency ambulance services. Every single one, except America. We're the richest country on earth. We spend more on healthcare than anyone. But we're the only place where calling for emergency help can bankrupt you. This isn't an accident. This is a choice.
Let's talk about how insurance screws you during emergencies. The out-of-network scam. Your insurance has a network. In-network means they've negotiated rates. Out-of-network means full price. Ambulances are often out-of-network, even if your hospital is in-network. You can't choose your ambulance. 911 sends whoever is closest, so you end up with bills your insurance won't cover. The not medically necessary denial. Insurance can decide months later that your ambulance ride wasn't medically necessary. Heart attack, covered. Panic attack you thought was a heart attack, not covered. You owe $3,000. How are you supposed to know the difference while having chest pains? Ground ambulance, $1,500. Medical helicopter, $40,000 to $100,000. Insurance might cover ground transport, but if they send a helicopter, you have no choice, you might owe $50,000 plus. People have literally mortgaged their homes to pay helicopter ambulance bills. Wisconsin, 2021. Woman has stroke. Husband calls 911. Helicopter airlift to hospital. She survives. $56,000 for the helicopter. Insurance paid, $0. Out of network. They're still paying it. Texas, 2020. Man gets in car accident. Paramedics stabilize him. 7-minute ambulance ride. Bill, $2,500. His insurance covered $400. He owes $2,100. He didn't choose to get in an accident. He didn't choose the ambulance company, but he owes $2,100. Florida, 2022. College student has severe allergic reaction. Roommate calls 911. Ambulance arrives, treats her, transports to hospital. Bill, $3,200. She's on her parents' insurance. Insurance says the ambulance was out of network. Family owes $2,900. She's 19 years old, working minimum wage. That bill will take years to pay off. Americans have normalized crowdfunding to pay for medical emergencies. GoFundMe reports that 1/3 of all campaigns are for medical expenses. People are begging strangers on the internet to help them pay ambulance bills. This is dystopian. This is a failure of society. In no other developed country do people need to beg for money online to afford an ambulance ride. 43 million Americans have medical debt. 66% of bankruptcies in the US are due to medical bills. Even people with insurance go bankrupt because insurance doesn't cover everything, because surprise billing exists, because ambulances are allowed to charge whatever they want. Young Americans are being taught by their parents, never call an ambulance unless you're dying. TikTok is full of videos. Call an Uber, not 911. How to survive without ambulances. This is generational trauma, teaching your kids to avoid life-saving services because of cost. In what world is this acceptable? Americans live with constant medical anxiety. What if I get sick? What if I need an ambulance? What if the hospital is out of network? What if I can't afford it? This isn't normal. This is a society in crisis. Every other developed country, you get sick, you get care, you don't go bankrupt. America, you get sick, you do mental math about whether you can afford to survive. Let's be very clear. This system is working exactly as designed. It's not broken. It's functioning perfectly for the people making money. Private equity firms own ambulance companies. They profit from high bills. Insurance companies profit from denying coverage and keeping premiums high. Hospitals profit from inflated prices. Politicians receive donations from all of the above and protect the system. The only people not profiting? Patients. Ambulance companies and insurance companies spend millions lobbying Congress to keep this system in place.
They fight against price transparency laws, surprise billing bans, rate regulations, and public ambulance services. Why? Because regulation means less profit, and profit is more important than lives.
Americans are told we have the best healthcare in the world. By what metric? Life expectancy? Lower than most developed countries. Infant mortality? Higher than most developed countries. Medical bankruptcy? Literally only us. Cost? The highest in the world by far. We don't have the best healthcare, we have the most expensive healthcare. And we've been propagandized into thinking cost equals quality. Here's the glitch. We've accepted that profit matters more than survival. We've accepted that calling for help might bankrupt you. We've accepted Ubering to the ER as normal. We've accepted crowdfunding ambulance bills. We've accepted that people die because they can't afford help. This is the glitch, and we're living in it. Every other developed country figured this out. Ambulances don't have to cost $3,000. Emergency care doesn't have to bankrupt people. Insurance doesn't have to be a scam. We choose this system, or rather, our politicians choose it because they're paid to. And we're told we can't change it, that universal health care is impossible, that this is just how it is. It's not. But what can I do? Vote for politicians who support healthcare reform, Medicare for all, public ambulance services, price regulations. Share your medical debt stories. Normalize talking about how this system is failing us. Support surprise billing reform. Contact representatives. Demand ambulances be included in protections. Refuse to accept this as normal. Stop defending a system that would rather you die than lose profit. If you're reading this and thinking, this is fine, this is normal, Americans just need to work harder, then congratulations, you've been successfully propagandized. But if you're thinking, this is insane, why do we accept this? Good, you're awake. Now do something about it. Drop a comment. Have you or someone you know taken an Uber instead of an ambulance? What's your worst medical bill story? Non-Americans, what do you think when you hear about $3,000 ambulance rides? Subscribe to The Social Glitch for more videos exposing the systems designed to extract wealth while we suffer. Because next time you have an emergency, you'll think twice before calling 911, and that's exactly what they want. Welcome to America. Don't get sick, and if you do, call an Uber.